Okay, so I'll start off by sharing my presentation today. Hold on one second. So here, I should start to share first, obviously. Okay. Okay. Let me know when you can see my presentation, okay? Okay, great. So today's topic is exciting for us, my well self, because we're going to be talking about how to set your wellness goals for 2023. Now, I know this time of the year is very exciting for everybody because I don't know about you, but I usually tend to set my goals at this time of the year. So we thought this meeting was timely because we wanted to add some support in getting people to set their smart wellness goals for 2023. So thanks for being with us today, and we hope that you really get something out of this. All right, so just some, I don't want to say ground rules, but just some reminders when we get things going today. We really want to make this an interactive meeting. This is not meant to be super serious. You know, we're talking about wellness, yes, but let's make it interactive. Take some notes, comment and share where you're comfortable. And again, let's just make this a to B kind of thing. Grab a pen and paper, or maybe use your cell phone. And just really take some notes. We really, again, want you to get something out of this meeting. So take some notes. And really what we want you to do is leave with making some smart wellness goals for yourself, right? Number 3, get ready to learn something new. Like I said before, we really aim to provide some value in you being able to set some wellness goals for yourself. And last but not least, let's make this fun. This doesn't have to be serious. So let's make this exciting and something to look forward to. All right. So again, just setting the tone for our hour together and setting some intention to get this going. All right. And with that, I want to introduce myself. My name is Brenda. I'm the CEO and founder of My Well Self, and I'll give a little backstory about how this platform came to be. So people don't know this about me, some do, but my background is in pharmaceuticals. I was in that space for probably 15 years of my career. And what propelled my well self was my health issues. I went through some personal health issues and decided for the first time in my life that I was going to, address them in a more wellness, holistic driven way. And unfortunately, in that journey to find care for myself in the wellness space, I failed. It failed. And I pretty much wanted to create a platform that would help people like me, that would help people to be more intentional with accessing the wellness care that they ever so needed. And so that's a little bit about how My Well Self came to be. And with that, in our journey, we realized that our consumers were looking for some true one-to-one support. I'm just going to let someone in. Hey there. So just join. We're just kind of starting the meeting. Feel free to sit back, relax, and just join our conversation today. So with that, we realized that in speaking with our consumers, meaning people like myself, they really wanted some support, some hand-holding, and not only identifying where they want to go in terms of their wellness, but also who was going to help them. And this is where our wonderful nurse wellness care navigators come in. And I want to introduce Emma today, who will be speaking later on. She's part of our nurse wellness care navigator team. Of course, Maribel Jody, who unfortunately won't be with us today as she's traveling. And this is pretty much our, I guess, navigation team that I'd like to introduce today. So welcome, Emma, and thanks for participating today as well.
Yeah, thanks, Brenda. Really nice to be here. I don't know if you want me to say some words about my background.
Please, yeah, absolutely.
Sure. Okay. So I'm a registered nurse. I've been working in the field for a few years now. I have experience as a medical floor nurse and as a public health nurse. I'm currently working out in BC, actually, on Vancouver Island. I'm working as a health director for a First Nation, which has been very rewarding. So um, I've worked in a lot of different areas of the healthcare field over the past few years. I really strongly believe in integrative care, and um, bringing in those alternative and Eastern styles of medicine to complement wellness, and referring to Western medicine when necessary. So as a nurse, it's always my goal to have people living at an optimal state of wellness, backed by those alternative therapies. And then when things happen and health goes really downhill, that's when we refer to Western medicine. So that's how I think about things. I have been using alternative therapies for my whole life to keep myself well. I've always been an athlete, so I've seen massage therapists and chiropractors many times for sports injuries, and I focus a lot on nutrition in my own life and spiritual care. So I look forward to helping connect people to practitioners that can help them do the same.
Wonderful. Thanks, Emma. We are very, very excited to have you and Maribel on the team. It's a really important time for us right now. So thanks, Emma. And Emma will be giving her part of the presentation later on. But before we do that, again, just a brief introduction as to who we are. So we're a personalized wellness concierge service that provides one-to-one virtual support from wellness care navigators. That's, again, who we are. And so this is where the exciting stuff starts. I want you now to grab that pen and paper, or perhaps your notepad on your cell phone or tablet or whatever. And I want you to think about what you want to achieve for 2023 when it comes to your wellness. Ask yourself whether that's an area of well-being physically. Is it mentally? Is it spiritually? Whatever that is. And once you're thinking about that, I want you to start making that list. You can start with 1, you can start with 2. It's really up to you. And use your imagination and really think about what you want to achieve for 2023. And not only that, I want you to remove any barriers or challenges in that. So remove any, I'm not sure if I'm able to access it, when I'm able to access it, remove those barriers. And again, just use your imagination, okay? So that's part number 1 of this. So start thinking of that list. But while you're doing that, I want you to make sure that your goals are SMART. And I don't know if anyone's heard this acronym before, but SMART is a way for people to define their goals. It's not only used in wellness, it's used pretty much anywhere. And the reason why people use SMART goals is because they want to be able to know where they're coming from, where they're going to. So pretty much you want to measure where you start, where you end. That's pretty much how simple it is. And so the acronym is defined as a goal that is specific, a goal that is measurable, a goal that is achievable, a goal that is realistic, and a goal that, last but not least, is timely. So again, having a SMART goal helps you to measure where you are from point A to point B or Z, whatever that is for you, so that you can see your progress as you're going with time. And so I find SMART goals are great for me. I'm a very analytical person. So for me, I'm able to see how I'm going from step A to step B. Otherwise, I'm just all over the place for me personally. Okay, so again, thinking about those goals you want to make for 2023. And now ask yourselves, okay, how can I make these goals SMART for myself, more measurable for yourself? So this is where it's going to get exciting. I'm going to quiz you guys, okay? And I want to make sure that you really understand what a SMART goal is. So if you have the capacity, I'd love to see what your answer is to this question. So let's take a poll. So we have 3 people here who have some goals for themselves for 2023. I want to ask you, which one is the SMART goal? So we have person A who says, I want to reduce my back pain. Person B says, I want to commit 2 hours a week to my mental health for 6 months. And person C says, I want to eat better. So in the chat, I want you to let me know who has the SMART goal. Okay, great. So great. Thanks for participating, everybody. So we have B's, B's, and B's all around. Yep, great. That's perfect. So yeah, B is the answer, right? So this is a SMART goal again because it's measurable and this person has a specific plan for themselves over the next 6 months. That's great. I'm going to quiz you guys again. So again, let's take a poll. We have 3 people. Which one is the SMART wellness goal? So I want to work with a health provider 1 to 2 times a month to better my gut health. Sorry. I want to eat more vegetables. I want to walk more. Which one is the SMART goal? Yep, you guys got it. Great. You guys all got it. So great. I just wanted to reiterate what a SMART goal was so that you guys can work on your own goals for 2023. So if I didn't say it, yes, you're correct. The SMART goal is I want to work with a health provider 1 to 2 times a month to better my gut health. Great, or my gut health, sorry. So now let's work on yourselves, okay? So I'm going to share I don't mind disclosing, I'm going to share what my wellness goals are for 2023. And it's in 2 points. For me, it's mental health and it's physical health. So my first one is mental. It's a priority for me. And I want to commit 1 hour biweekly to my mental health for a year. I think that I need to be more kind to myself for 2023 and take some time to understand what that means for me. So I've already made this goal. I've already slotted my appointments in with my mental health provider. And this is what I'm going to focus on for 2023, 100%. My other goal is more physical. So for me, I want to work with a health provider 1 to 2 hours a week, probably 1, it's more realistic for me, to help address my increasing knee pain. So for me, again, I don't mind disclosing this. I've had some increasing knee pain happening, more specifically on my left side. That's just getting worse. It's starting to limit my physical capacity. And so I need to find someone who's going to help me. I haven't identified whether it's going to be a car. I don't know yet really what that means. So this is where probably I'll be using my own platform to get that addressed for 20. Okay. So I hope we've given you a good foundation for helping you to define what your SMART wellness goals are for 2023. And so with that, I guess I'll allow, I think we said about 3 minutes, right, Emma? Maybe 2 minutes for you to take that moment for yourself and define what those goals are for you. So if you are comfortable, you don't have to. If you're comfortable, we'd love to hear what those are. You do not have to say them if you don't want to, if you don't feel comfortable. But if you didn't mind sharing, you're more than welcome to. Okay. So we'll give you guys a couple minutes and let you define those goals for yourself. Again, we want to really make this a valuable session for you. So go ahead, start the clock and go ahead and make those goals for yourself. Hey there, we have some last minute entries. So welcome to our presentation. We're just doing a little bit of homework. We're taking a couple minutes for you to define some smart wellness goals for 2023. So if you want to just dive right in, please go ahead. So we have about a minute remaining where we'll possibly move on to the next step. So. Okay, so my timer is timing. It's going off. And again, does anyone feel comfortable sharing? If not, that's fine. Does anyone want to share what their goals are? If you're comfortable sharing?
I could share some of mine.
That'd be great. Thanks, Tanika. Go ahead.
Yeah. So for my physical goal, I would like to work out for 30 to 60 minutes, 3 times a week, for 6 months. Just because I used to be able to work out more often. That was actually before some of the lockdowns from the pandemic, and I just fell off for like a year and a half at least. So I want to get back into setting that habit, but also still being kind to myself to not go like full throttle initially. And for my other goal, this is more around mental health. So committing 1 hour a month to my mental health by seeing a therapist. And I'd like to do that for 1 year.
Yeah.
Yeah, so that one's pretty clear, pretty straightforward. But I did struggle to set some goals around nutrition and hydration, which is something that I do want to focus on. I work too much, so I don't leave enough time for that in the day. So I'm just not sure how to phrase those goals. I don't know, like, if I need to be eating a certain amount of per day or drinking a certain number of cups of water a day, but I know that I want to do something to improve those 2 areas.
Wonderful. Thanks so much for sharing. And I'm glad that you're able to set those goals for yourself. Thank you. That's great. Does anyone else feel comfortable sharing? You don't have to go on video. You can place it in the chat if you're comfortable. Okay, great. We have something in the chat. Okay. So wonderful. So I'm just kind of repeating what someone said. I want to commit 1 hour a week to journaling and doing shadow work. Okay, great. I want to commit working out 3 to 4 days a week with a personal trainer. Wonderful. For 6 months. Wonderful. That's great. So it feels to me, when you set these goals, they just feel more lighter, they feel more tangible. And it's really realistic for yourself. So I'm glad that you guys are kind of taking those learning lessons to make these goals for yourself. That's great. If no one else wants to share, that's fine. I'd love to move on to the next part. Okay, so now that you have those goals in front of yourself, you've taken time to really understand what means what to you. Now the question is, okay, now how do I achieve my goals? Okay, so I've taken the time to write these down. How do I achieve them? How do I get there? And possibly who's going to help me to get to that point? Okay. And with that, I'd love to explain again, reiterate what my well self is and how we could possibly help you execute those wellness goals. So we help to assess your health challenges. We help to define your smart wellness goals, maybe fine tune them. We help support your smart wellness goals, keeping you accountable. And of course, last but not least, we help you to triage your health issues and get to the providers or services that would help you achieve those goals. Okay, and with that, I am happy to introduce Emma, who's part of our Nurse Care Navigator team, on how our Nurse Wellness Care Navigators can help you. And with that, Emma, I can just go ahead and start your slides. You can let me know when to kind of pass on to the next slides, okay?
Sure, yeah, thanks, Brenda. So as a care navigator, for everybody that joined a little bit later, I'm a registered nurse. I have a background in medical nursing, public health nursing, and community nursing. I have a strong personal connection to alternative therapies and the supports that my well self is able to connect you to. So my job as a nurse wellness care navigator is to first off have a meeting with you and explain how things kind of work with my well self, give you an introduction to our system. Then I would go through a general assessment with you where we talk about either the wellness goals that you've already set, or perhaps a challenging experience that you're having in any area of your life. We're thinking about health holistically, so that includes your mental, your emotional, spiritual, social, and physical health. So once we've kind of done a general assessment, I'll go through with you and help refine your goals and help set micro goals. So like little steps to get you to your goal. And then once that's established, I'll be able to suggest different providers that we could connect you with to help you in achieving your goals. So what is the standard health assessment? So after you kind of get introduced to my well self and what that's going to be like, I'll go through with you and chat with you about what your primary concern is. So like for Brenda, her primary concern is her knee pain. Then I'll start asking some questions to get a better picture of what's going on and to get a better understanding of your lived experience. This will include assessments around your holistic well-being in each of those areas. It's really interesting how connected our body is in all of those areas. So like, even though Brenda's experiencing knee pain, I'll still ask some questions about her emotional health to see if they might be connected, or if providing that emotional support might help with pain management going forward. I'll also ask about medications, any natural supplements that you're on, any recent diet changes that you've had, or lifestyle modifications. I'll ask about timelines, just to get a really good picture about what's going on. And then we'll be able to start some SMART goals. Or if you've already established SMART goals in an exercise like we did today, we'll discuss those and make steps to get you to where you want to be. Once we've done the self-assessment, we'll go through and identify some wellness providers and treatment pathways that might work for you. So this will be in a conversation based on what you've told me. I will think back on my experiences and my knowledge of the care providers that are available to us and provide some recommendations or some suggestions to you. I'll be able to kind of discuss what a treatment would be like, maybe some questions that you want to ask that care provider. And then once I've recommended those, it's up to you to decide who you want to see and who you want to integrate into your personal care plan. All right, Brenda, I think I'm ready to go to the next slide. So there are a few cans and can'ts for us. So because I'm a nurse, I'm not a physician, I'm not a naturopathic doctor, I cannot diagnose. That's outside of my scope. What I can do is using my knowledge, I can explain what may be causing the issue, what things might be related to the issue, and then guide you towards a practitioner. In the case where what you're experiencing is really complex and maybe I don't have all of the information that I need to properly guide you, there is the option to see a naturopathic doctor who can do that diagnosing and can direct you better than I can outside of my scope. Another thing that I can't do is I can't choose for you. So I'm going to provide options of which care providers you can go and see, but you have to make the choice to go and see them or to choose which one you want to see or which two you want to see, however many you want to see. The last thing that I can't do is I'm not going to do a formal referral. And what this means is you'll have to go through and book an appointment with a practitioner, and then you'll have to do an assessment with that practitioner so that they can ask really appropriate questions to determine that the service that they're going to provide you is appropriate to what's going on in your body and is safe. I'm going to do the very best that I can to refer you to somebody that, or not, sorry, to recommend to you to somebody that is going to be able to help you. But it's that practitioner's responsibility to make sure that it's a really good fit. All right, Brenda. I don't know if there's another slide, but if there is.
No, I think you're done. Yeah, I think that was a great explanation. So thank you, Emma, for taking us through what it means to work with you on My Well Self as a care navigator, what your capacities are, what your capacities are not, to help people to define their wellness goals for 2023. So with that, I think we can move on if no one has any questions, but I think that was great, Emma. Thank you. You got me excited about it. Okay, so I think we're at the end. We said that we were going to call this for an hour, but I anticipated it would be between 30 to 45 minutes, but we're at the end. So we hope that you got some value out of this short presentation. Number one was getting you to think about what your wellness goals would be for 2023. Number two was making sure that those wellness goals were SMART, right? They were achievable, they were measurable, they were realistic, and so on, based on the acronym for you. And then last but not least, you know, we got an introduction into My Well Self and our wellness care navigators, and how perhaps if you were comfortable, they would be able to help you achieve those goals for 2023. Okay, so we're going to leave you with some homework. We really want you to be intentional with yourself. If you haven't had a chance to really think for yourself, you know, how you want to approach 2023 in terms of your wellness, take that 5 minutes for yourself and just define what those SMART wellness goals are for you. You know, put a reminder on your cell phone, put a sticky note on your fridge, whatever it is, and try to achieve them best you can. And if you're looking for any support in that process, feel free to visit our website to learn more about how we can, you know, achieve those goals for you. So if you haven't seen that birdie right there, go ahead and subscribe to our newsletter to learn more about our platform and, you know, having us as a resource out there. All right. So that is the end of our presentation today. It was short and sweet. And if nobody has any comments, I think that we can leave you with some time today. Okay. And with that, I will sign off and say thanks to everyone for joining today. Oh, we have some chat in here. Yes, thank you, Tanika, very much for joining today. And thanks for everyone for taking time out of your day today. All right. Thank you. Bye-bye.